Hi, my name is Joe. I'm a student at the University of Pittsburgh, and today I'm here to show you how to draw medication into a syringe. There are multiple steps, so we're going to break them down one by one so that you know you're practicing correctly. You have a practice kit given to you by the school. It has real equipment in it, so don't start opening it or touching anything in there until you watch this tape. The needles inside your kit are sterile, so if you stick yourself with a needle, don't worry. However, once the needles are no longer sterile, if you touch them or anything, you then stick yourself. It's the same as if you'd stuck yourself with a nail or a pin or anything like that. So you would have to, treat it appropriately and wash it off and know when your last tetanus shot was. Because the needles are real, don't play around with them with your friends. And whatever you do, never throw a needle into the garbage, because even though you know it's okay, if anyone else were to get stuck with it, they would be extremely stressed out about it for years to come, as they had to worry if it was contaminated. So please bring the needles back to school as instructed. You can practice this anywhere you want, but typically you'll be standing up, so I'm going to show you how to do all of this while standing up. Your kits will vary year from year, but inside every kit you will have some alcohol wipes, similar to these. You're going to have a plastic or glass vial, similar to a bottle with a top on it. And you will have syringes of differing sizes, such as these. You'll also have needles, which you must be very careful of. We'll start with the bottle, correctly called a vial. In class you're going to learn about the 5 rights and 3 checks to make sure that you're giving the medicine you think you're giving, to make sure it's the correct medicine. But for right now we're going to focus on the skill of getting the medicine into the syringe. We're using normal saline, but the procedures we're showing you are the same whether you're using morphine or potassium or any other medication. The normal saline that you have may be expired, but this right here is just for practice, so don't worry about it. Alright, so first thing that we're going to show you is how to take the top off. These are called pop tops because you just pop off the top. Take your thumb underneath. You take your thumb, place it underneath, just pop it off. As you'll see when you take the top off, the top is made of a silver aluminum band with a rubber stopper on top of the bottle. You might think that this is sterile, but that's not guaranteed. So this is where you would use your alcohol wipes to clean off the top of the bottle. There's a possibility that different agencies will have different protocols as to how many times they want you to wipe the top off with the alcohol wipe. Next we're going to talk about syringes. Right now you have a very limited variety, but when you open the drawer in the hospital you could see anywhere from 10 to 15 different varieties or configurations. When you open your kit, you're going to have syringes of many different sizes. The sizes are measured in milliliters or units, and they will be labeled on the back of the package. Find your syringe marked insulin and note that it is calibrated in units. Some syringes come without needles attached, others come with needles attached, and this information is written on the package. Let's first talk about a syringe without a needle attached. You pick the size syringe you need based on the amount of medicine you need to give. You open the package the same as you would open a 4x4 because there are certain parts of the syringe that you need to keep sterile. Now you can reach in and pick it up in the middle like this. And you need to keep the top part where the needle is going into. You need to keep that sterile. You also want to keep your hands away from the plunger. Now that you have the syringe open, we need to get a needle open and attach it to the syringe. You select the size needle depending on what you're using the needle for. A long needle goes in further than a short needle, so if you're giving an injection subcutaneously, you don't really need a very long needle. You'll learn more about this in class. Needles, besides varying in length, also vary in diameter. What you need to remember is the smaller the gauge, the thicker the needle. So if someone said, would you like me to inject this into your arm with a 16 gauge needle or a 25 gauge needle, which one would you pick? Sometimes it can be a little tricky, but you'll do fine. One thing to keep in mind is if you're trying to open it from the wrong side, it won't work. So make sure you find the correct side and open it like a 4x4. Now that you have your needle open, you need to think about what you need to keep sterile. Our objective at this point is to get the needle onto the syringe while keeping the sterile end of the needle sterile and the sterile end of the syringe sterile. We pick up the syringe and the needle and place the two tops together, and they'll have laces on top that will slide into place as you screw them together, and when you're done it will lock into place. So sometimes you're going to find the right size syringe with the right size needle all pre-packaged together. When we open it, it's a good idea to tighten the needle into the syringe because sometimes they come loose and you need to make sure that they're locked together. Like so. We're going to take a second to talk about safety real quick. After you've used your needle and syringe, it's important to never recap a needle on your own. For that reason, a lot of syringes and needles come with protection built in. This syringe comes with a sheath that will slide out over the needle. After it's covering the needle, you have to be careful because it can go back down on you. Another system, one that can't be dislodged, is attached to the needle itself. This white cap here. You place your thumb underneath the white cap, just push up, and it will cap itself, and it won't come back down. This part of the needle here is a safety mechanism that you can use to cap a used needle. You simply press up on it like this and it will slide up and cap the needle for you. Once you do this, you cannot undo it. So now we have taken the top off of our vial, cleaned the top of our vial, selected the right size syringe and the right size needle that we're going to use, and now we're going to take the medication out of the vial. In order to make getting the medication out of the vial easier, you draw air into the syringe. However many milliliters of medication you need, you draw that much air into the syringe. In the beginning, your instructors are going to check how much air you're putting in order to check to see if you are reading the syringe properly. So I'm going to say that I need 2 milliliters of the medication. So I take my cap off, set it down, place one finger on the plunger and one on the collar and pull back. To 2. Right now I'm not touching the plunger, although that's hard to see. I put in 2 cc's of air into my syringe. Now that I have my air in the syringe, I'm going to put it into the vial. There are a couple different ways of inserting the syringe into the medication. The first is to simply hold the bottle, start from above, and insert the syringe into the medication, and press down. There are a couple different ways of inserting the syringe into the medication. The first is to leave the medication on the counter, hold the medication, insert the syringe from above, press in. So now that you have your air in there, the solution will come out very easily. However, the needle normally does not reach the medication from this point. You normally need to invert the bottle and the needle. As you can see, I'm kind of out of hands. I can't control how much fluid is going into the syringe. So to fix this, I want to get the bottle and the syringe into one hand. To fix that, take the bottle between your middle finger and your index finger, and then hold the syringe between your thumb and your pinky finger. And then you can use your other hand to control how much solution you're pulling into the syringe. This is something that you're really going to have to practice. Inject 2 cc's of air into the vial. Put your index finger and middle finger around the bottom of the vial. Going to inject 2 cc's of air into the vial. Place my index and middle finger around the base of the vial. And withdraw 2 cc's of fluid. What you'll see many nurses do is do this all in one simple step. But you have to get control of your bottle, your needle, and your syringe, or else there'll be an accident. You get your syringe ready, put the air into your syringe, pick the bottle up between middle finger and index finger, insert the needle, inject the air, you want to check your dose by bringing the syringe up to eye level and seeing that it reads 2 cc's. If you have any air bubbles, you need to get rid of them. This is an example of an air bubble in a syringe full of colored liquid. Alright. If you do have any air bubbles, take your middle finger and click it against the syringe. As we see, I have 4 cc's of liquid, but I have air on top. So the only thing I need to do is expel the air, which I do by as you see, I have too much air. I have 4 cc's, but air on top, which is not going to come out by flicking the syringe. So to get the air out, I have to push the plunger up. Like so. So, to keep in mind, if you have an air bubble, you loosen it by flicking the syringe to get the air bubble to the top, and if you have too much air, you expel the air by using your plunger. But one thing to keep in mind about air is that air rises. So right now it's on top, and if we push the plunger up, the air will come out of the syringe. If we turn the syringe around and you have it facing the ground, the air will be on top above the liquid, and all you'll end up doing is expelling the liquid. So it's important to keep in mind, keep the syringe facing up, and in that way you'll be able to expel the air. You want to check your dose by bringing the syringe up to eye level. Now that you have the medication in the syringe, you don't want to walk around without a cap on this needle, so you're going to recap the needle. The only time you can recap a needle is before it's been used on someone. You never recap a needle if it's been used on anybody. So what you're going to do is you're going to find the lid for the needle, and you're going to want to avoid trying to put the lid on yourself. You could miss and poke yourself. So what you do is you leave the lid on the counter, take the needle, slide it into the lid, this is how you put a cap back on a needle. Take the needle, slide it into the cap, and lift, jiggle down, and then press down on the cap to secure it. This is an odd looking needle. You need to get this out of the way, like that. You can really get it out of the way before going near your patient by pushing it all the way down. You've given your injection. Now this pink part becomes your safety cap. When you engage your safety, you can use your fingers, but when you do, keep your fingers away from the tip. Make sure you go from the bottom down here. A safer way is to use the table.